Welcome to the 2020-21 South Carolina High School League Guidelines for Phase 1 Return to Play. I'm Tammy Newman. I am the Public Relations Director for the South Carolina High School League, and I will tell you it is indeed my pleasure to not only welcome you, but also our distinguished panel of presenters today. Before I introduce our panelists, I would like for you to cover a few housekeeping items, such as please, everyone be mindful of your environment, and let's all keep the noise level to an absolute minimum. I'd also ask that everyone please either turn off your cell phones or mute your ringers. Another reminder, we are on the South Carolina High School League's Facebook page. We are on Facebook Live. That means that if for some reason you would like to revisit something that is discussed today, it will continuously be available on our Facebook. So keep that in mind. I will now introduce our panel. And once I introduce all of our panelists, they each will give an informative presentation that will most likely answer all of the questions that you have previously submitted. We'll also have a little Q&A at the end, but I think that we're going to cover a lot of information, and I ask that everyone please, you may not think that you need to hear from one of our medical specialists or the athletic trainer, but trust me, you will need to pay close attention to each of our panelists. They're going to give some very important information that's going to cover anything and everything that you have a question about. Okay, so first I would like to introduce Mr. Jerome Singleton. He is the commissioner of the South Carolina High School League, and I believe he's been part of this family for over 25 years and been at the helm for 16 years. We also have members of the South Carolina Department of Health and Environmental Control, which we all know and love as DHEC. We have Ms. Myra Reese. She is the Deputy Director, and she oversees the agency's environmental programs, and she's been there over 35 years. We also have Ms. Fran Marshall. Hi, Fran. Director of the Office of Applied Science for DHEC. And she's an industrial hygienist and a lawyer by education and training. She was also an athlete throughout her high school years as well. And we also have from DHEC, Dr. Brannon Traxler. Hi. She has 2 years at DHEC with 10 years in clinical practice prior to that. Her areas of expertise, her role there is disease control chief in DHEC's COVID-19 incident command. And last but not least, we have Sheila Gordon, one of our very own. She is a nationally certified athletic trainer. In addition to being the South Carolina Athletic Trainers Representative for the South Carolina High School League Executive Committee, and she serves full-time at White Knoll High School as their athletic trainer. So I would like to welcome everyone on our panel here, and I can't wait to hear all the information that you have moving forward. We are going to start with Commissioner Singleton.
Thank you, Tammy. Ladies and gentlemen, we're experiencing very challenging times. And I'm sure as we move forward, a lot of anxiety will continue to exist. It is our goal to create an environment that is safe and healthy to allow our student athletes, our coaches, and staff to conduct in-person activities. Our student athletes and coaches and staff have been separated physically for quite a while. To many, it's like being separated from family, people that you are closely connected to. It is our hope that we take this opportunity to reunite, reconnect, and celebrate being able to once again participate in education-based athletics. As we begin this process, I ask that you help us by being supportive of each other. In addition to adhering to the guidelines that have been shared, take the time to reassure each other that this time will pass and we will be better because of it. Parents, communities, and the state are watching. And we have a golden opportunity to show so many people that there is a light at the end of the tunnel. and that the value of education-based athletics still holds its rightful place in society. In reference to the guidelines to return to play team sports, we are currently in phase 1 of a 3-phase process. The information has carefully been compiled and surmised by a task force of representatives from the league staff, South Carolina superintendents, athletic directors, and coaches, and the Sports Medicine Advisory Council. Additionally, the information has been reviewed and vetted by the State Department of Education Accelerate Education Task Force, by DHEC, and discussed with a representative from the governor's office. These guidelines have been shared with the member schools, and we have the opportunity to conduct member schools online meeting to discuss the guidelines in more detail. We have received several questions of clarification that have been submitted by the member school. We will try to answer these questions through presentations by today's panelists. With that in mind, I'll take this opportunity to thank my fellow panelists for being a part of this meeting. Schools, to include middle and high, have the opportunity to begin phase 1 when the district or schools determine that the school facilities are safe for occupancy by the students and staff. In most cases, this coincides with summer academic activities that are permitted at the school. Given that some schools will not conduct on-campus summer academic activities, districts will have the flexibility to set those start dates and time. Phase 1 is designed to ease the students back into conditioning and athletic activities. With the suspension of normal school, student athletes have obviously been limited in their ability to condition and work out. With temperatures rising in South Carolina, it is so important that the coaches ease into conditioning and workout activities with the student athletes to prevent incidents of heat illness. With that in mind, coaches should prioritize strength and conditioning workouts over any type of skill development. You know your student athlete best. Do what's in the best interest of them health-wise. Thank you.
Okay, thank you, Commissioner Singleton. And now we're going to move to our friends at DHEC. If we could have Ms. Reese, if you would like to start and provide the information.
Sure. Good afternoon, everyone. And let me make a few comments before I turn it over to Fran and Dr. Traxler. One is I just want to thank the South Carolina High School League for the remarkable job that you did on these guidelines. It was your experts in your field. You know where the challenges are with implementation of guidelines, and I think they were incorporated, at the same time putting front and center the health of your athletes, your staff, all of you as coaches, and ultimately it is a positive impact on the community when the athletes go back at home. So thank you for your leadership. Also, a big thanks to the coaches across the state. The power and the influence that you have on our young people is just amazing. And I think now during these unprecedented times, it is so important to bring high school sports back to our youth. And you take the leadership that you show and the positive impact is just remarkable. And I know that firsthand. I will say that I am a Strom Thurmond High School graduate from Edgefield County, was always involved in sports, near and dear to my heart. I had 2 sons that played football for North Augusta High School. So I know the positive influence that the coaches have and the work that you do. I also just want to emphasize that the student athletes are already leaders in their community. And I think with the pandemic, this offers another opportunity for the athletes to become very familiar as they start practice. They'll understand why these guidelines are so important and understand what the coaches are trying to do to protect them as athletes and protect the team and the whole school, is that they'll realize that what they do when they leave practice and leave school is just as important when they go back home, and to take some of those best practices, some of those guidelines, the basics that we're going to be talking about today, and be student health ambassadors for us across the state. We're going to be looking to set up some of these student health ambassador chapters across the state, and we'd love to have this league and the coaches and sports part of that. So thank you again. And with that, I'm going to turn it over to Fran Marshall for her to begin. Let me say too that we're here today. We're very, very excited. We are permanent partners, and we are your DHEC support team. We're going to be here for you as coaches, as athletes, as schools, as things continue to progress and you're faced with certain challenges. You'll know that the team of Myra, Fran, and Dr. Traxler are here to support you. So, Fran, if you would kind of start off and kick off some of our information.
Sure. Thanks for the opportunity to be with y'all. These are certainly uncharted times for us. First, let me say I'm a proud graduate of Irmo High School, where I played basketball and ran track. And so I have appreciated that and all the gifts that gave me, even still today, and it was a long time ago. What I want to talk to you briefly about is the general guidelines. The whole truth is, if everybody in South Carolina were following the general guidelines, we'd be in good shape. So it's really important that not only do you understand how these guidelines will be implemented in your, in sports and in high school and middle schools across the state, but it's also important for people to take home the message and follow these things when you're not at school or not at a workout. I talked to a company 2 weeks ago who had 2,000 employees. They've worked continuously throughout the whole pandemic, not had any cases. They had their first case that came from somebody who lived with somebody who had it, and they didn't take the right precautions. So it's really important. I think you've all heard by now what the basic precautions are. Self-isolation. If you're sick, stay at home. Practice social distancing of at least 6 feet of distance to the greatest extent possible. And again, some of the speakers who come after me are going to talk to you about how specifically we're going to implement this in your situation. Wash hands frequently, 20 seconds, with soap and water, or use a sanitizer that contains at least 60% alcohol. Clean and disinfect frequently touched objects. Avoid touching of eyes, nose, and mouth with unwashed hands. Cloth face coverings, you're going to hear some more about those in the endeavors that are getting ready to happen for you. Cover mouth and nose when coughing or sneezing. Avoiding use of common equipment, and minimizing the use of soft surfaces where possible. So a hard chair is easier to clean and disinfect than a cloth chair, as an example. The specific portion of the guidelines that you have, again, kind of goes to how you're going to implement these general guidelines that are applying to everybody, to all of us all the time. We appreciate all of your efforts to help us minimize the spread of this virus. We all want to get back to normal. We all miss sports at all levels, and you are the key to our success in getting back safely. With that, I'm going to turn it over to Dr. Traxler.
Thank you. Hello, everyone, and thank you for being with us. And I also want to thank Mr. Singleton for asking that DHEC participate in this. I also am a graduate of South Carolina high schools and participated in South Carolina High School League events. I ran cross country and track for Christ Church Episcopal School and actually Jerome High School back in the day in Greenville. So I want to talk to you a little bit. First, I was going to mention some of the symptoms that are more common in children, because I know that's something that a lot of people want to know, and it's not a lot of information out there on it, to be honest. We don't know as much about children, and of course, as everyone has said, this is such a new and unprecedented thing. We don't have even as much data as we often do, even for adults. For children, basically, there's just a couple of studies out there, and the best one that's one that came out of New York City, which is the only one I could find in terms of the United States. It was in the Journal of the American Medical Association Pediatrics here recently. And they looked, it is a little skewed because they looked only at hospitalized children that had COVID-19. And so, they're going to be a little bit sicker. We really don't know what percentage of children, don't have symptoms or those asymptomatic. But in looking at the ones that are hospitalized, and keeping in mind that they're probably the severest of the ill, 80%, so 4 in 5 of those children had fever. And I know that there's a discrepancy with a couple of different temperatures on the documents. 100.4 is the cutoff for fever, and that's per the CDC. So had sorry, I'm not sure what that noise was. 80% had a temperature higher than that. 64%, so a little over half, had respiratory symptoms, either a cough or shortness of breath. And then 6% only had GI symptoms, nausea or vomiting or diarrhea or stomach pain. So that's something to keep in mind, that those can be symptoms of COVID-19 too. You've probably heard some recently, there's this multi-system inflammatory syndrome in children. That's a very rare situation that looks like there might be a correlation, with COVID-19 recent or current infection. At this time, I'm not aware of us having any in South Carolina, and I'm pretty sure I would be aware. But that is something that's out there. And with that, you basically get inflammation and disease in a lot of the different organ systems. And it can be a little bit more severe. So looking at the compromised immune systems or chronic diseases, I know that's another one that a lot of people ask about. There is evidence, at least in adults, that those people have worse outcomes. I have not been able to find any study that proves it in children necessarily, that they actually have worse outcomes or are more likely to get a symptomatic infection. There's also not really a hard and fast prescribed list of what these conditions are. And even people that have some of these conditions, like, for example, asthma, there's a wide variety in terms of the severity of it. And so what's right for one person may not be right for somebody else. And so it's hard to give a specific list and say, don't participate with these. So, a lot of that comes down to looking at each individual's risk. And Dr. Mazaway or Sheila may speak on this later, but looking, in terms of talking to the healthcare provider, for your child or for your student, have them parents talk to the healthcare provider and see what they recommend, whoever's managing that illness. The big thing I want to talk about is social distancing, because that is really our biggest method of prevention for this virus right now. We don't have a treatment for it. We don't have a vaccine. So a lot of it comes down, and this is what these guidelines are based off of, that 6 foot or more social distancing. And so you can't do it enough. You can't do it too much or enough. A couple of the questions I know we got were restrictions on group numbers and whether they were the same for indoors versus outdoors. And at this time, yes, the group number needs to be the same regardless. Though in general, if it's an activity that you can do outside just as well as you can indoors and the weather's okay, I encourage you to do it outdoors. Outdoors is always preferable to indoors with this virus. But it doesn't eliminate the need to keep the group small and keep them spread out within that group. Groups of that 10 will be allowed to move from one facility to the next, as long as there's a cleaning of that facility between uses, and when they're moving between the facilities, they keep the distance from another group, for example. So don't let them mingle with another group on their way between places. That's unfortunately ways that this can get spread. And a lot of folks say, well, why is the social distancing so important? We know, and there's more and more evidence coming out, that this virus is primarily spread via person to person. So when you talk and when you cough, sneeze, of course, you expel little droplets with the virus in them. Somebody else that's close enough can breathe those droplets in, and it can infect their airway and their lungs. Other ways that you can get infected are, of course, touching something that somebody has touched with the virus on their hands, and then touching your mouth or nose or eyes. The most common is being in close contact with somebody. And close contact is defined as less than 6 feet from them for at least 15 minutes or more. We also know, however, though, that the amount of droplets somebody's putting out can affect the risk. And of course, when you're working out, just as if you were singing or shouting or cheering, you know, you're breathing heavily, you're more likely to expel more of those little droplets. And so that's why, especially with sports, it's really key to keep that 6 foot distance so those droplets fall to the ground basically and can't get inhaled by somebody else. The problem if we don't do this social distancing comes down also to what happens to a group if there is a case within that group. Anybody that's been within 6 feet for 15 minutes or more is considered to be a close contact for COVID-19. And so those people then have to quarantine. They have to stay home and away from other people for 14 days. And unfortunately, just even if they go and get tested and test negative, you know, the person who was exposed, it doesn't get them out of that quarantine. They still have to quarantine. So we can keep the group smaller and keep them further apart. There's less risk of people being close contacts to each other. And hopefully less folks, even if somebody does get sick, that'll have to stay home and not participate. And that's the principle behind, for example, why we want folks to really try to take their own transportation separately and try to carpool as little as possible, you know, to and from sporting events or to and from the practice field and all, is because riding in that car is often for 15 minutes or longer. And I think it's always at less than 6 feet distance. And so everybody in that car is going to be exposed. You know, if one person develops some symptoms, what I really recommend is that they go then and, you know, and get tested. The others in the car are allowed to continue, you know, their life while you wait for those test results. But if they get those results and that sick person was positive, then the others are going to need to stay away for 14 days. And so obviously the fewer the people in the car, then the better that is for everyone. So that's a good example of why you really want to avoid that close contact and why we want to keep the group small and in as big of areas spread out as much as possible. And so I think with that, I'm going to turn it back to Tammy.
Yes.
Yep. Thank you.
Okay. Thank you so much for that information. And also, I would be remiss if I did not backtrack a little. I believe when we were doing introductions, Dr. Mazaway, somehow, I do not know how, but I overlooked your very impressive introduction. So before you start, let everyone know exactly who Dr. Christopher Mazaway is. He is an associate professor and chair at the University of South Carolina School of Medicine, Department of Orthopedic Surgery. He's also the chair of Palmetto Health USC Orthopedic Center. And most impressively, he is our chairperson for the High School League Sports Medicine Advisory Council, which most of you may know as SMAC. So again, apologies for not doing that earlier, and we are ready for your presentation, Dr. Christopher Mazaway. Let's see. Go ahead.
All right, go ahead. So, all right, thanks, Tammy. No problem there. So really want to thank Commissioner Singleton. Absolutely amazing job working on this to get together these policies. This is really difficult work. There's no precedent for a pandemic that has halted our nation and the world for months and is still a very real threat to tens of thousands of Americans. We know that many of you will have objections to some of these protocols and question them. Remember, these rules have been put in place for many reasons. First of all, the safety of our kids, our coaches, our administration, our families, and our communities. This has to be first and foremost in everything we do. Thankfully, we have not seen a high rate of illness and death in our younger populations, which we just heard about, but we're still learning a lot about this virus and its effect on our citizens. So these rules have been put in place as our medical experts and our government agencies are requiring social distancing policies, hygiene policies, and masking policies to limit the transmission of this virus. I was a high school three-sport athlete. I was a college football player, and I know I've been around a lot of high school, college, and professional athletes and coaches, and I've always heard that success is dependent upon discipline. So this is another opportunity for us to instill a sense of discipline in our actions and those that of our student athletes regarding this virus. I think it's really important that we're disciplined. We have been given an opportunity, thankfully, to get our kids back engaged in athletics, which we all agree is important. If we show discipline in phase one and we prove to our kids and our parents and society that we are respectful of this virus, we'll possibly be given an opportunity to move to phase two. Remember, this isn't guaranteed. We have to do our part to make sure that we progress. Obviously, the goal is to get back to playing sports, and if we do our part, hopefully we can get there. If we fail to do our part, we may not be given the opportunity to move to phase two and lose the opportunity to give our kids participating in athletics an opportunity this fall. So, and we all know that that's not going to be good for anyone. So remember, there are a lot of different opinions regarding this virus. Some families are ready to move on regardless of the risks of this virus. Some have been severely affected by the virus. I'm fortunate enough also to be the medical director for the University of South Carolina. And I was on a conference call with football parents the other day. And a lot of different opinions and concerns with regards to their student athletes returning back to the University of South Carolina's campus. One of the things that moved me the most is we had one mom who was really concerned about her kid getting back to sports and to the University of South Carolina because she had 7 family members and friends who died from COVID. So again, we've got to remember that this has affected people in many different ways. She felt comfortable allowing her child to return to sports at the University of South Carolina because South Carolina has adopted very strict social distancing policies, hygiene policies, and masking policies. The same ones that we're asking all of us to do at the high school league. So we need to prove to our kids, our families, and society that we are understanding the risk of this virus and will act accordingly. So with that being said, I want to touch it a little bit, has already been said, about some of the risks and chronic illnesses with regards to COVID-19. We know that this disease has been, or this virus has created diseases, ultimately illnesses and death in our older populations, and especially our older populations with comorbidities. And in our older patients, that's been identified as hypertension, obesity, asthma, and other lung diseases, diabetes, and patients with immunocompromised status. So what does that mean? So patients who are undergoing treatment for cancer, or patients who have blood diseases and can't develop an immune response. We have a lot of information in our older populations. We just simply don't have that in our younger populations. And so there's not a lot for us scientifically to guide us exactly how we move along in this process with our return to sports. What we need to make sure that we do is everything we can to maintain our policies. And just as we've heard, we need to make sure we maintain social distancing. We need to make sure that we follow proper hygiene protocols, and we need to make sure we follow masking protocols. And if we do that, our student athletes need to get cleared medically in order to be able to participate in our sports. If there are any concerns at all with regards to chronic illnesses, we need to make sure that that student athlete follows up with their physician and is cleared to return back. But as long as we're doing the right thing, as long as we're following our phase 1 protocols, and as long as we're smart, if we're seeing a student athlete who's compromised or looks like they're having some issues, we need to be cognizant of that. We're making sure that we do screening policies at every practice and opportunity to make sure that our student athletes are safe when we get back to this phase 1. And so again, with regards to chronic illnesses, as long as we're smart, as long as we're aware, and we take our student athletes' best interests at heart, we should do fine there. So I'm going to hand it back over to Tammy.
Thank you, Dr. Mazaway. And I believe we are now ready for our athletic trainer, Ms. Sheila Gordon.
Good afternoon, everyone. I want to start by saying thank you to Commissioner Singleton and the High School League for allowing me to be on this call. Again, my name is Sheila Gordon. I'm the athletic trainer, and I'm the past president of the South Carolina Athletic Trainers Association. I also represent them on the Sports Medicine Advisory Committee, and I'm also a part of the District 3 representative on the National Athletic Trainers Secondary School Committee. And so as it's been said before, and I know you'll hear this stated multiple times in multiple different ways, but in order for us to have the best opportunity of sports returning to some type of normalcy, we have got to be diligent in following the guidelines placed before us. We are all in a challenging situation that we've never experienced before. And again, like it's been said, these are best practices as they are today. This information is changing daily. And so these are best practices as we know them today. So what I want to do in my presentation is address some of the concerns that some of you guys have had. And so I want to help define and clear up a couple of questions that you have had. So when it refers to facilities in the document, this will refer to a different area across your campus. So for example, you have the baseball field, softball field, tennis court, gym, football field with or without a track around it, weight room and classroom. All of these different areas will be considered and defined as separate facilities. You cannot divide your spaces up. You have 9 players and 1 coach that will be allowed per facility. We're trying to eliminate the gathering of large numbers of student athletes while on campus at one time. Now realize when you have 9 athletes and 1 coach, you may have an athletic trainer that may come into the area, or you may have an athletic director or the head coach come into that area, but they still should be practicing social distancing as they're trying to supervise their kids. So we are trying to eliminate those large gatherings. So make sure that you try to stagger your start times if at all possible. So when athletes are working out, conditioning and practicing, they produce particles from their mouth. And we've already talked about that just a little bit. These particles can travel as potentially infectious aerosols. Even though it's much more risky to be inside than outside, the risk is still present. Now that we've assigned our pod, your 9 athletes and 1 coach, they should continue to work in that pod. They can move from one facility to the next facility once the facility has been sanitized. Your athletes have a chance to sanitize their hands, and they do not cross paths with other pods. Weight room equipment and sports equipment should not be shared within the pod. Each student athlete should have their own equipment. Then it can be cleaned between each session. Check with the CDC on approved products to sanitize your areas. In order to reduce aerosol transmission, masks should be worn by coaches at all times. The only exception would be if a coach is actively participating in the workout, such as a cross-country coach running with their kids. Students should arrive on campus with their mask, and it should remain on until they begin their conditioning activity. Once a student athlete begins their active session, they can remove it and then put it back on when they've completed that session. Now, have a plan for hydration. We want to minimize the number of contacts, such as hands on a water cooler or a water cow. We want to make sure the kids are safe, so have a plan if a student shows up without a water bottle or needs a refill. There seems to be some confusion about the number of days, 10 days or 14 calendar days. This is not an acclimatization period. This is a time that we can slowly add these kids back in front of their coaches and add them some conditioning. So this is a time period where we should slowly get our kids back on campus. This should be per sport. So once your football team has been participating for 14 days, then you can add sports equipment to your conditioning, even though it still cannot be shared during this time. So lastly, for our athletic trainers, the thought is to eliminate unnecessary personnel on campus and exposures. So use your judgment. If you think a student athlete needs your services, then treat them as necessary. If they can be given a home exercise program, then utilize that option as well. I look forward to working on phase 2 and phase 3 as we move forward. But again, we've got to be diligent in following these guidelines so that hopefully we can return to some normalcy in sports.
Thank you, Sheila. And again, if everyone that's participating in today's webinar, if you've paid close attention to all of our presenters, all presentations just covered an enormous amount of the questions that were submitted. We do have time now to hit some of the questions that were submitted, some specific questions. And, I ask your forgiveness if we reiterate some of the topics that have already been discussed. But I do believe that some are, warrant us driving home some real clear clarifications on the questions submitted. So I will hopefully, Mr. Singleton, I'm going to start with you with just some quick ones, back to back. That's probably just a yes or no, if we could get from you. First off, we had a question, is clinic week still dead or is originally scheduled?
Well, clinic week currently is still dead. The one that we did remove was the week of the 4th. That's no longer a dead week. Schools will be permitted to use that time for conditioning and workouts. But
Okay.
currently the one that we have, the clinic week, that no change has been made on this at this time.
Okay, and you just answered another question about July 4th, so good, thank you for that. And this is a question that I know has been repeated many times over since we released the guidelines, but can you please clarify, do we have a start date and when can we begin? Can you clarify that for all over the districts?
As I said earlier, the start date will actually be at the flexibility or at the discretion of the district. When they feel that their facility is safe to be used by the student body and the staff, then they can use that, they can begin that as their start date. Usually that coincides with when they will start academic group or academic summer activities. Well, we know that some of our schools won't have any academic summer activities on their campuses. So when they have determined that that building or that facility is safe for use, then they can make those decisions themselves.
Okay, you bring up facilities. Do the guidelines that we set forth apply to the teams and coaches that choose to use non-district facilities?
Well, the guidelines is really based on safety. So it would make sense that they would use the same guidelines regardless of where the facility is located. There's a lot of facilities that exist that our schools use that is not on their campus. Tennis, golf, swim. I mean, all those are alike. We still think that the guidelines should be followed regardless of where it is.
Okay. Well, I'm going to shuffle this around a little and have a question out. And this, I think, can be answered by either Ms. Gordon or Dr. Mazaway. So let me make sure I've got Dr. Mazaway is, okay. Let's see, if a student doesn't start phase 1 when school starts, can he or she start 2 weeks later? Is there a specific time frame that if a child comes in and misses phase 1 and we're already into phase 2, how would that work?
Yeah, I can take this. So, you know, phase 1 is a voluntary phase where we're hoping to get our kids back on campus and get them active, and so there's not really a specific timetable necessarily. If a student athlete misses phase 1 and we're into phase 2, the student athlete doesn't have to go back to phase 1. You know, we've identified at that point that we're ready to take the next step. And so we can integrate the student athlete back into phase 2 protocols.
Okay, thank you, Dr. Mazaway. For our friends with DHEC, this was a really big, very, very popular question that we had. Came in several times. So can you please explain or define each use when we say all equipment must be sanitized between each use?
Fran?
Sure. Each use means between each person touching it. So if it's a ball, you know, that's why in phase 1 it doesn't have the use of balls, because you can't throw it back and forth with, you know, between people. You can't disinfect it in the air. So equipment needs to be cleaned and disinfected in between each person using it.
Okay. And when you say disinfect and sanitize, give us some examples of that.
EPA has a list of approved chemicals for disinfecting. Cleaning actually means soap and water. So disinfecting is the better of the two. And disinfecting needs to be using one of those EPA approved chemicals. We can certainly provide a list. They're readily available on the link from the CDC guidelines.
Okay, yes, and if I would ask if you send us that link, we will be happy to put that on our website as well. Thank you. That was a very, very popular question there. And while I have you, I'll also ask this. This was another question that came in. What was the specific temperature? I know there was some discretion going back and forth of the 100.3 versus 100.4. So can you explain that?
Yeah, the CDC guidance is 100.4 or higher. So equal to or greater than 100.4 is considered a fever by definition related to COVID-19.
Okay, thank you. Okay, and we're going to move back to Ms. Sheila. Sheila, one of the questions that was directed to you. Let's see, and it pertains to the throwing of a ball, when the equipment use between players and so forth. Will they need to are they required to wear gloves? And is there 5, 10, 20, 30 yards apart? Can you go a little bit more in depth on the use of any equipment between the students?
Well, I think this question really is pertaining to a quarterback and the conditioning of the arms and that kind of thing. And so during the first 2 weeks, sports equipment, including balls, are not permitted. And so once we start adding balls back to the equation, still at that point in time, they cannot be shared. So throwing to a receiver from the quarterback would not be permitted. In order to condition arms, we can get creative and we can do certain things. We can do some band work. We can do throwing into a net. There's certain things that we can do to gain some strength within the quarterback's arms, if that's what the concern really is.
Okay, and Mr. Singleton, a general question that came in several times was physicals. Is there any variance on physicals, or is that rule still in place fully? Can you talk a little bit about the physicals?
Yes, at this time, the physicals for this upcoming year will still have to be done April 1st or beyond. Any physical that occurs prior to that will not be useful at this time. So we're still using the physical process that we've always had in the past. Just remember that physicals are required for school against school competition during in season, during the summer and the like, while a lot of districts feel that that's important, and I do also, but it's not mandatory from the league office that physicals be held for practices and or out of season competition.
Okay, and it's kind of staying on topic with that. Assumption of risk was mentioned in the guidelines of form. Do you have, where can they find the template for that, for the schools to use for the assumption of risk?
Well, we actually listed that under guidelines of consideration, things of consideration. Actually, the league doesn't have one. When that was added to it, it was just an idea that they could use within their own district, create it themselves. Just something to make the family aware, make the athlete aware that there is a risk involved. Normally, the assumption of risk we have was always due to some type of risk that you could be injured. Well, now we've got some other things that can possibly come up with these, with competing. So again, that's still left up to the discretion of the school district to create something that they would make people aware and understand that there is a risk involved with being in the sports world today.
Okay, and another question that we had, can the use of ladders or ground dummies to run around and over be used during phase 1?
Well, the short answer to that is yes. As long as it's being used for agility purposes. What we don't want to allow is for dummies to be held where we got opportunity to violate the social distancing piece, which is 6 foot apart. We don't want to have somebody holding a dummy and then somebody running into a dummy because it violates the 6 foot apart. But if they're being used for agility purposes, then whatever apparatus you want to put down there, you're able to use.
Okay. And we're going to go back to Dr. Mazaway. Question for you. Can a student athlete with a chronic illness get medical clearance from their personal physician to participate during phase 1?
Yes. Again, if there are concerns with regards to a chronic illness, they can follow up with their physician and they can have a discussion and get cleared to participate in athletics.
Okay, good. Thank you so much for that. Let's see, and I'm going to bring this one back to DHEC. think, let's see, you can unmute. We ready? Okay, here we go. There are restrictions on group numbers, our group numbers whenever we're indoors versus outdoors. So can you explain or just reiterate those social distancing or restrictions for indoor sports versus outside?
Sure. So we really want to stay in those groups of 10, whether we're indoors or outdoors. As I mentioned earlier, outdoors is generally preferable. The bigger, wider space outdoors you can be in, the better compared to indoors. But regardless of which place, we want to stay in that same group of 10 and keep the folks within that group spread apart, spaced at least 6 feet apart or more as much as possible.
Okay, good. Sheila, got another question for you. I'm sorry. Did DHEC? I didn't know if you had anything else to add to that.
No, we're good.
Okay, great. Sheila, just swinging it back to equipment and so forth. When using the weight room, are schools allowed to have spotters?
Even though I know spotters are necessary for safety, at this point in time, we have to get creative when using the weight room. So no spotters would be allowed at this point in time because it would violate the 6-foot rule. And so more free weights, lighter weights, more reps, that kind of thing is going to have to be necessary. There should not be any maxing at this point.
Okay, I'm going to stick with you for a second. Regarding the use of face masks, can you give a definition of a student athlete not actively participating in a drill?
Sure. If they're in a classroom, maybe you're doing a film session, they should be wearing a face mask. If they are going through a walkthrough where they're not actively participating in a drill, then they should be wearing a face mask. They should arrive to school with a face mask on. They should keep that mask on until they actually get to the place where they're beginning their conditioning. And once they start conditioning, getting that heart rate up, respiration rate up, then they can take it off.
Okay, and again, Sheila, and this maybe you and Mr. Singleton can tag team on this, but I know we went over, I think all of you touched on this, but a very clear clarification on, is it the 10 days and 14 calendar days per individual, or is that time frame? Can you elaborate on that again?
Yes, it's 10 days. If you go Monday through Friday, it's 14 calendar days if you don't include the weekends. So if the football team comes out and they've done their 10 days, Monday through Friday, then they're allowed to move to that third week where they can add equipment. But if it's it's not per athlete, so you're not having to take attendance to make sure that this one kid gets 14 days or 10 days in conditioning. It's per team, per sport.
Okay, and I know that we had previously discussed when the questions were coming in, and you gave a pretty good breakdown, an example, I'd say, of taking the temperature. And if a student athlete came in, you don't know what the environment they're coming in from, a hot car without AC, and that, can you give that example again of taking the temperature, if it does read one thing as soon as you take it, and the waiting period, and what you would do in that instance?
Sure. So my recommendation is when they come to the testing area, the pre-screening area, and you take the temperature. If it happens to be 100.4, then what we're doing is we're giving them the opportunity to sit in a lobby type area, something that's air conditioning, because maybe this kid came to practice in an unair conditioned car. And so the opportunity, we want to give these kids the best opportunity that we possibly can. And so after that 10-minute period, if it's still running high, maybe it's 100.4 again, then what we're suggesting is send them to the athletic trainer to do an oral temp. Because actually this kid could have been out in the sun yesterday, gotten a sunburn, and of course he's going to appear to have a fever. And so I think after that period of time, then the athletic trainer will take an oral temp.
Okay, thank you, Sheila. And as I'm shuffling through a lot of the questions, I think that most of you have repeatedly answered a lot of the questions that came in. We got a lot. So right now, if you'll allow me, we have received a few questions during this presentation from some of our viewers. By the way, we have over 216 viewers, so thank you, membership, for supporting that. But I'm going to check these questions real quick and see if we can get some quick answers out. Here's a question that's coming in. If an athlete uses gloves, would they still have to sanitize any equipment, weight equipment, etc., if they're using individual gloves? Let's see, I think that's DHEC if you're trying to answer. Yes.
Okay, sorry. So yes, we still want folks to sanitize their hands, even if they're wearing gloves. And really, I urge people to not routinely wear medical gloves around just as a part of their everyday life. If you're not doing things that specifically indicate it, like medical care or cleaning, most folks, would still unfortunately touch their face with them on and could contaminate themselves, or they won't take them out contaminating. And so we really want folks to, even healthcare providers, when they take off medical gloves, they wash their hands afterwards. So we still want folks sanitizing everything between uses and washing their hands or using disinfectant.
Thank you. Okay, another question, and I believe this one, Mr. Singleton, you may grab this one. Cross country, can we have more than 9 individuals on a course if we stagger the start and not allow grouping?
Well, one of the things that we want to be careful of is to have grouping, because even at the beginning of it, there's grouping that's going to take place while instructions are occurring. So I think at this point, we probably need to not try to find ways to circumvent, for lack of a better term, the rule, but let's stay in the middle of the road. Let's not even get near the edge. Let's start it with where we are so we can have a chance to move forward to something else. So the short answer to that is no. Let's stay with grouping as much as we can. And we've got something that's organized that we can look at, and we can make some more decisions based on what's been happening.
Okay, and I believe this is a question for you as well. What is the penalty for not following guidelines? Do the coaches, if it's an unintentional violation, do they need to self-report, or do they just need to, run everything by our office?
Well, if they've got some questions about what they need to do, by all means, call our office first. But if they have a clear understanding of it, the expectation is for them to follow it. It's interesting you asked what's the penalty. The penalty for not following it is probably that we probably won't have sports, because we're not able to not everybody's being on the same page, not everybody's working together. That's the biggest penalty that anything can have, is to do something and then put us in jeopardy of being able to offer the sports. That speaks for itself.
Okay, thank you. And several questions, and I believe you between yourself and Ms. Gordon, this has been answered, but it's come in during the presentation. So if you or Ms. Gordon could answer this again to reiterate and stress and explain, I guess, the play areas. Can a football field be divided to 2 areas? Can a practice field and a game field be considered 2 different facilities? Can you just kind of elaborate on the difference of facilities?
Yeah, again, you cannot divide a facility. Again, just as Commissioner Singleton was speaking earlier, we want to really do a good job of following the guidelines and trying not to push the rules or circumvent the rules and that kind of thing. So a game field and a practice field would be 2 different facilities. So you could have a pod on the practice field, a pod on the game field, but you cannot split a facility. You can't split a gym. You can't split the weight room. You can't split the football field. So.
Okay, and Sheila, you had mentioned pools. Can you share just a little bit about swim teams and swimmers and the significance of the pool versus?
Sure, I think, and I think DHEC may be able to help answer that question a little bit too, but we're not as concerned about being in the water. It's being on the pool deck. And I think that's where we really have to make sure that we're limiting grouping and gatherings and make sure that we're maintaining that social distancing while on the pool deck.
Okay.
Yeah, and I will just add to that, Tammy, that we have some guidelines that are specific to reopening pools, that if some additional details are needed, we can certainly make sure that the schools, the coaches have that specific information and the link on your website.
Okay, thank you so much. We will be glad to put all of this information on our website as well. And Sheila, you did mention earlier, you went over a couple of examples of water at practice and during workouts and everything, but can you go over that procedure again? Say if a student athlete does not have a water bottle, or they run out of water, what is the safest and best practice for guidance on the watering procedures?
Sure. I think first and foremost, you need to speak with your district personnel to find out what the appropriate plan might be there. If a kid comes to the facility without a water container, then do you send them home? Do you accept them? Do you give them an unopened water bottle? You need to have a plan in place because simply what we're trying to do is eliminate contacts. And so having a child or an athlete touch the water cooler as they're trying to refill their own, or a water cow and squeezing the nozzles as they're trying to refill their own. So we're encouraging them to bring quite a large water container, for an example, a milk jug, because hopefully they won't be on campus that long. I know the kids potentially have not done anything in 10 or 11 weeks now. So the potential is there that they're going to need some water, and we want them to be hydrated. And so we really want them to try to do a good job of showing up to practice hydrated already, but to have a water container and just to have a plan in place. I mean, it could be something as simple as giving them another unopened water bottle, but encouraging them the next day to make sure that they bring a larger container of water.
Okay. And Dr. Mazaway, if a student athlete tests positive for COVID, will a school have to shut down the entire group, or only those student athletes showing symptoms?
So I probably need to defer that to DHEC, to be honest with you. I think they might be honestly in a better position to answer that.
Okay.
But thanks for thinking of me.
So I think it depends on where the person has been and what the facility was that you were using. If somebody tests positive, we may, if it's a smaller facility, it's indoors, and they were there for a fairly long period of time, we may recommend you temporarily close it for some cleaning. If it's outdoors, out in the natural environment, it's kind of hard to clean, or a cross-country course, for example. So we're not going to shut that down. So it really is very situation specific, but at most it would be temporarily, just long enough for a good cleaning.
Okay.
And this is part of why, Fran just made a great point to me. I mean, this is why to keep these limited is really why, into the pods is why, is because we don't want to have to shut down these facilities and so forth. And so that's part of doing the pods.
Okay, thank you. Dr. Mazaway, I do believe this one may possibly be a question for you, but correct me if I'm wrong. It is pertaining to pre-existing conditions and chronic diseases. Currently, the guidelines say individuals cannot condition. Define what chronic diseases we are talking about. And they're wanting a clear, more defined definition of that.
Yeah, so in general, it's anyone who has a chronic, illness. I know that's a broad term, but then the specific illnesses that have been talked about most are hypertension or high blood pressure, lung disease, asthma, diabetes, and immunocompromised states. And so those have been the ones that have generally been identified in our older populations. But again, they haven't been very well defined in our younger populations. So again, if there's any concern whatsoever, we recommend follow up with your family physician or pediatrician or primary care provider.
Thank you. And there's a couple of questions pertaining to competitive cheer. One being, are cheer mats, can cheer mats be used? And I believe that would be Mr. Singleton possibly, or Sheila. Hello?
Sheila, you mind taking that?
Okay, sure. Yes, I think we've gone in two different directions on the cheer mat, whether or not it's actually considered sports equipment. But again, if it is used obviously for safety reasons, then it still must be clean between each use. And that's hard, because if you've got two cheerleaders passing through, that makes it a little bit difficult. So what I would recommend, obviously, since we should not be, and we will not be stunting during this time, is to eliminate mats if we can at this point in time, just simply because you should be doing the cheer portion, maybe some tumbling portions, but no stunning at this time. So for logistical reasons, I would suggest no mats at this time.
Okay. All right. Let's see. And I believe, just from the questions that have been submitted previously and those that have come in today, I think we've covered a broad area. I think you all done a great job of hitting some very specific concerns. Before we close out, we've been on actually right at an hour, so good job, everyone. But if there's anything, does anyone have anything that they feel that we didn't touch on that you really want to, strengthen, any responses that we've had, or any areas that we didn't touch on that you think is very important? Commissioner Singleton, is there anything that you would like to say before we close out?
Tammy, I'd like to allow the other panelists to speak first, and then I'll close out.
Okay, well, Dr. Mazaway?
Yeah, so excellent questions, and I'm sure you'll have more. Again, this is unknown territory. We are all trying our best to navigate through these troubled waters. Again, this is phase one. And so there's a lot more information we're going to gather over the next few weeks. We are hopeful, obviously, to move to phase two, but have to reiterate, we have to do what we need to do to give confidence to our society that we can move forward. Again, we're talking about high school athletes throughout the entire state of South Carolina, and so there's a responsibility there. So as leaders, as coaches, and administrators, we need to do our part to make sure we give our kids the best chance to play this fall.
Thank you, Dr. Mazaway. And if I can, I'll move over to our friends at DHEC. Is there any closing comments?
Yes, and just want to thank you all again for the great work that you did to put these guidelines together. They are right in line with the CDC guidelines. And at the same time, I think we need to recognize, like we have with other reopening sectors across the state, is that there always is something going to come up that we may not have anticipated, or we have more questions. And that's why I think it's so important for us to be available to you. When you get into a situation where you have your first positive case, you want to really have some specific questions. And we want to be accessible for you, kind of walk through the scenario, and just support you in any actions that you need to take. And what y'all are doing is just great for us as a state and as a community. We greatly appreciate it, and we really look forward to continuing to work with you. Fran, do you have anything, or Dr. Traxler?
Yeah, I just want to thank all of you in advance for your leadership in this effort. And I want to thank your student athletes for being leaders in their communities as well. Again, it's very important that people follow the guidelines both while they're in your vicinity, as well as when they leave and go home and go to other things. So we really appreciate what y'all are doing. We look forward to helping you any way we can. Thank you.
Good.
Thank you.
Okay. Thank you so much. Ms. Gordon?
I want to take the opportunity to thank the high school league for putting together the task force with the different folks that they invited to bring their expertise to that group. And just thank the coaches and the athletes and the parents for really looking at these guidelines, being role models. I thank you for your leadership in our community. And, you know, we can do this and we can give us our best shot at sports returning in the fall if we will just follow the guidelines that are put before us. And we're dedicated to making sure that we stay on top of the current research and the most current best practices. And you know, and we can modify and adjust when it comes to phase 2 when we get there. But we've got to be diligent in phase 1 in order to get to phase 2. So I thank you all in advance for your leadership and being a role model for these kids in our community.
Thank you, Ms. Gordon. And now for Commissioner Singleton.
Thank you, Tammy. First, I want to thank the panelists for joining us in this meeting. This couldn't have been done well without your presence and your expertise. You really helped us. To our schools, our challenges ahead of us. Just know that we've got to continue to work at what we're doing. There's a lot of local decisions that can be made, but we have some guidelines in front of us that allows us to make what our best decision with the information that we have in front of us. As I said earlier, there's a lot of people that are watching, and we have a great opportunity to be a big influence in what occurs. What happens at the school and away from the school will have a big impact on where we are. We don't know what phase 2 could look like. We have no idea when phase 2 could actually be implemented. Things change every day, so it's got to be very fluid. We'll continue to be in close conversation with DHEC, in close conversation with the Department of Education. We'll be in close conversation with the task force that we have in place. And we'll also continue conversation with representation from the governor's office. And as we find an opportunity to move into phase 2, know that we will do it. If we do our part today, and we do our part in phase 1, we'll have a great opportunity to hopefully move into phase 2 and phase 3, where we can move to some normalcy of being able to play the contest. Continue to look at those guidelines. If a question comes up, don't hesitate to give this office a call. We're at your beck and call. We'll answer any questions that you have. I just ask that we not try to find ways to circumvent the system, but to work well within the system so that we can have this great opportunity to offer educational athletics as we always have in the past. Again, I appreciate you being a part of this. I appreciate the panelists. Tammy, I appreciate you moderating it and everybody that played a part in putting this together. Please know that it's very much appreciated. Thank you.
Thank you. Again, reiterating Commissioner Singleton's words to the panel, Dr. Mazaway, Ms. Gordon, our friends at DHEC, thank all of you for joining us today. And it's not just today and what you did today, but what you've been doing throughout all of this and working with us side by side and helping us get our next school year moving forward and getting our athletic programs back started. I do want to remind everyone that we do have a 3:30 online press conference coming up that will continue on Facebook Live. That will be with our delightful South Carolina friends in the media. They will be speaking with Commissioner Singleton. I'm thinking a lot of the work that you did just now will probably answer a lot of the questions that the media have, but that starts at 3:30 here on Facebook Live as well. And other than that, I think that we can close this out and thank everyone and thank our 200+ guests that we had that submitted questions and that were watching along with our general public.
Thank you, Tammy.
Thank you.
Thank you.